On Obamacare now, and the White House saying how they plan to help insurance companies that could be stuck with unexpected costs after the plan's rollout. They're outlining what they are calling risk corridors, a term that means they're provisions aimed at compensating insurance companies, basically, that end up with bigger costs than they had anticipated. It's another development as the March 31st deadline to sign up for Obamacare is fast approaching. What does all this mean? With more on this, we're joined by Georgia Republican Congressman Jack Kingston, chairman of the Health and Human Services Education Committee, and is a senior member of the Defense Appropriations Subcommittee. Lots of titles there, Congressman Kingston, but basically, you're an expert on Obamacare. What are they doing now? This is billions of dollars. What, to help insurance companies?
Well, absolutely. Eric, in short, this is just one more example of why Obamacare is a disaster and needs to be replaced with a market-driven, patient-centered health care system. It's done nothing but brought more government interference in the marketplace. This latest scheme is designed to really redistribute profits and losses. So if you obtain insurance through one of the state-run plans and your insurance company has too many losses, they will assess another insurance company that's had too much profit and move the money around. So it is absolutely a bailout. It is absolutely more government interference, and it is absolutely a socialistic approach to the marketplace.
Well, the White House would say that they're just trying to, make this fair and even and make the Obamacare work, and they say that the plan's going to work.
Eric, we've been hearing that for a long time, but the reality is there are still more people who are uninsured today than there were when Obama was elected president. So this has absolutely been a disaster because it's driven up the costs, it's driven up the premiums, it's driven up the deductibles, it's limited your choice of doctors, plans, access to health care, and now we're hearing from the same government that gave us this horrible rollout back in October that, don't worry, we now have a new scheme, and this scheme will be to make sure no one is making too much money and no one is losing too much money. I don't believe this government is smart enough to administer this. What they're trying to do is interfere with the marketplace, and as you know, the capitalist system is a lot better determiner of what the prices should be, and the strong survive and are weeded out, and that's the way the marketplace should work. But what they're going to be doing is propping up the weak insurance companies who have not run a good shop.
Well, some would say the capitalistic system hasn't, helped people who don't have insurance, who can't afford it, who had pre-existing conditions, and the plan, will help them. What do you think about that?
Well, I think that they're using those things as a reason to take over 1/6 of the economy. And the reality is there were plans on a state level to deal with pre-existing conditions and so forth, and the states were far better and more efficient than the federal government when it comes to these. But just keep in mind, this is a president who said the average family would have a $2,500 reduction in premium, and now we're seeing that everybody's had about a $2,000 to $3,000 increase. And we found out last week, Eric, on our committee that just to comply, just for the administration costs, it's about $3,000 per enrollee. Now, that's not for the health care costs. That's what the government is costing. So this year, the cost of administering Obamacare is going from $5 billion to $23 billion, and that doesn't include any of the insurance.
That's like almost five. That's almost like 5 times, Congressman. I mean, finally, and we're almost out of time. 2 weeks to go. They hope to get like 7 million people signed up. They say they have 4.2 million. Do you think they'll get that? Because one study from Avalar Health Organization says that they'll get 5.4 million. That's 20% fewer than the number that they say they need. And what does that mean to us, to Americans, if they get 20% fewer people in 2 weeks?
It means that this administration is going to want bailouts for insurance companies and for this plan, and the cost per individual is going to continue to increase. It really means we have to defund Obamacare and replace it with a market-driven, patient-centered system that is the private sector for so many of these solutions that we're looking for right now.
All right, Congressman Jack Kingston, we'll get you back again. 2 weeks to go. Man, oh man, we'll see what happens. Thank you.